and Human Services Committee meeting. Thank you for joining us via Zoom. We have one guest with us today, Rachel Besner-Kerr, who is going to do a presentation on the COVID-19 Tompkins County Food Task Force towards the middle of the meeting. I would like to make a change to our agenda. We do have a resolution that was emailed to everyone this morning. I want to make sure that everyone received that, all the committee members. I see Dan, Amanda, Glenn, you got it, and Deborah got it. Okay, good. And that resolution is resolution calling on the state of New York to release enhanced federal Medicaid matching funds to counties in New York City. ID 9312. Can I have a mover to get that on our agenda? Moved by Amanda, seconded by Glenn. And all those in favor?
Roll call, Shauna.
Roll call here. Deborah Dawson?
Yes.
Dan Klein?
Yes.
Amanda Champion?
Yes.
And Glenn Morey? Oh, Glenn, you're on mute. Sorry.
Yes.
Okay, thank you all. We will add this after number 6, the COVID-19 update. So let's move on to public comment. I have not received any public comment. We now do have a YouTube channel, and our meetings will be hosted live on the YouTube channel. And I believe Kathy has sent that information to all of us, and we could provide that to constituents. As far as public comment in future meetings, if people have questions, they are welcome to send that to public comment at tompkins-co.org. And we will send that to all of the members on the Health and Human Services Committee. Are there any questions about public comment? Okay, I see no questions. Let's move on to the chair's report. I have a pretty quick report. I feel like I keep saying the same thing, but I do want to say thank you to all of our essential workers out there that leave their families every day to go to jobs to take care of our community, whether it be food delivery people, healthcare workers, people that are serving us with transportation. You are truly the ones that are keeping our community growing and going. So I just want to say thank you for that. I also wanted to once again say thank you to Frank and the group at Public Health, but also the full Tompkins County staff, because I think that we have many employees who aren't really doing their typical day-to-day job, that have been moved all over the place and doing things that are sometimes out of their wheelhouse, but they have accepted graciously, and they are really, really making our county proud. So thank you to all of the county staff that's doing that. We will be receiving a Code Blue update today from Kit, as well as a COVID-19 update, and Frank and Jason are here and can provide that, and we'll have a question period for that as well. I did receive updates from all of the department chairs that report to Health and Human Services. I believe all of our committee members have received those updates. We received Veteran Services, Office of Human Rights, COFA, as well as Youth Services. If anyone that is tuning in today, Martha, Mike Sigler, let's see here, and Annie, if you guys would like the updates, I'm also happy to send those to you as well. I see some nods. So I will just send those all to the legislators, and we'll make those into one nice email for you. It's a good way for us to kind of get a feel for what's going on in our county. Typically, these departments would be reporting to this committee, and it's nice for them to be able to do business as usual. They're very busy, and not have to sit in a 1.5 to 2 hour meeting on Zoom. So the next point of business is that we have as number 5 our county administrator's report. Jason, would you like to give us a report?
Sure. I'll just keep it brief with respect to the resolution, the EFMAP resolution. That's a resolution that NISAC put together, I know at our urging on one of our calls last week. The EFMAP funding is aid that we are supposed to get from the federal government for Medicaid. It originally started through Affordable Care Act. Over the past 3 years, we have not had our reconciliation of this EFMAP aid. The state has withheld it from all counties. And then with the recent stimulus package, there is enhanced EFMAP aid. And our state legislators went to extreme measures, particularly Senator Schumer, to ensure that the counties did receive their fair share of this aid. So this resolution is encouraging and requesting the state to share with us how they're going to distribute the aid, whether it's through weekly shares or through reconciliation. That's the summary of it. You know, we have not gotten any word from the state as to how they're going to share this information. So I know all counties probably will pass this resolution or something similar to it, because we're all missing money that's entitled to the counties. So that's pretty much all I was going to report on, and let it go to questions if there's anything for that.
You know what? Why don't we actually go ahead and move this resolution up? I know I said it was going to be after number 6, the COVID-19 update, but since you brought it up, why don't we go ahead and put this on the floor and see if there's discussion and questions. Can I have a mover for a resolution calling on the state of New York to release enhanced federal Medicaid matching funds to counties in New York City, resolution ID 9312, moved by Amanda, seconded by Deborah. And are there any questions out there? Deborah, Dan, Deborah, you have a question?
Yeah, I do have one question. The way this is worded, it would have them calculating what the new money under the stimulus bills would be, and then applying that to our weekly payments. I'm still confused because the media was reporting that that money was going to be something in excess of $6 million for the state of New York. And then the governor kept saying, no, it's only going to be about $1 million. I mean, how are they going to calculate what the deduction from our weekly payments are going to be if they can't even agree on how much the money is?
I think that's part of the challenge with this whole process, is no one really knows what's going on, because the state hasn't shared with us any of the reconciliations they've done for the past 3 years. So go back 3 years, we were getting usually at the end of the year a reconciliation of additional EFMAP funding we were supposed to be getting. That hasn't happened, and now this thrown on top of it, there's been no communication as to what that clearly means. There's been no sharing of any transparency as to how the money's to be distributed based on what. So I think that's really what this is about, is saying, where's this money? It's entitled to counties. How are we going to get it? And start sharing information with us, because what I've gotten up until just recently, and I shared it with our folks at NISAC, was basically the state acknowledging the receipt of it and acknowledging that they'll be communicating with us in short order how it's going to be distributed. And that was just the gist of it. And that's what we've been hearing for about 3 years. So I have no answer for you, because there's no way of, I can't, they're not sharing any information about it. I know the governor wasn't particularly happy about it, primarily the part that requires the state not to change our weekly shares. So, he can't increase, can't do the Medicaid changes that he wanted to do, and has to accept this aid, and it has to go, basically can't, there's a part of it that can't impact his bottom line because it's just a pass through. But that's what was put in the legislation. We're entitled to this money, and frankly, we should receive it because we all need the relief.
So this would at least force their hand.
It's saying, hey, we know you got this money. Where is it? Start talking to us.
Well, we don't even know how much it is.
Nope.
Great. Okay.
Sorry.
Next, I have Martha. Also, I wanted to thank Martha. She made some edits to this resolution and put some time into it. So thank you, Martha.
Sure, you bet. Thanks, Shauna. And Jason, when was it that the state acknowledged that they have the new money?
So from what I've been told is that they accepted the first quarter payment at the end of March 23rd, and they accepted an advance of the second quarter payment April 1st. That's what I've been told by NISAC, and I think Amanda Spelsey probably had similar information from Senator Schumer's office. I obviously don't know, how true it is, but coming from different sources, I would imagine it's somewhat relatively true.
Yes, and I noticed that they accepted the new federal money while they were a week before they finished negotiating the state budget, during which they were trying to get the redesign team 2's cuts put in place, but they had already accepted the new money, which said that you can't accept this new money, you can't get this new money if you cut Medicaid. So they were really talking out of both sides of their mouth, but I'm shocked. So this is obviously, I think, a first step. This is a really big deal. I mean, Amanda had told us, it's 6.7 billion to New York State, and she had a specific number for us. And these are annual figures. I think it's assuming the crisis lasts for a year. So it's 6.7 billion to the state for a whole year. For us, it was, I think, 2.37 million, again, on an annual basis. It seems that, and then this is what the fight is about right now, about aid to local governments, about that the states are being expected to pass through the money. Seems to me that maybe I hope NISAC is preparing all the next steps. I think this is headed to a lawsuit. I don't know if the comptroller can be involved, if he's got a way to analyze this. This is not like up to Cuomo's whim. And I think we really have to call a question in a very aggressive way, because
I don't know, I don't think the federal legislation talks about timing and delivery of funds. So from a cash flow perspective, the governor and the state may have discretion as to when they deliver the money. That's all. I mean, that's what when we were on the conference call maybe a week ago, I mean, I think I was the one that brought this up, saying, hey, if NISAC can put together a resolution, I know all the legislatures and boards in the state would pass it. And that's when this came out. So I don't think there's a time frame of delivery of funds. And I know there are some things going on now with the state where they're delaying payments, which would suggest there's cash flow, reasons for doing that.
Sure.
So it's very possible that, yes, we might be entitled to this $2 million. We may not get it till next March, whenever they reconcile their books. I mean, I hate to say that, but I don't know that. I would imagine there would have been a time frame that we would have been able to latch on to if it was provided that way in the law. But I mean, it's worth asking, and I know NISAC's got on the radar.
Yeah, I guess my question is, when you're on those calls with the administrators and NISAC, I mean, we've been asking nicely for a very long time. It seems like that we have to step this up.
Yep.
Thanks.
Okay, are there any other questions? I see that Mike Sigler, Annie Corman, Leslin, and Anna are on the phone. Do you have any questions? Okay, let's vote on this resolution. All those in favor of resolution 9312?
Roll call.
Yep, we're going to do a roll call.
Good.
Deborah Dawson,
Yes.
Glenn Morey,
Yes.
Dan Klein,
Yes.
Amanda Champion,
Yes.
and myself is a yes. That's unanimous. Thank you very much. Next line of business is our discussion on COVID-19 update. Frank and Jason.
Well, I'll start. Frank says he'll finish. The past week and a half, there's still been, it's been active, but there's been more of a little bit of, I would say, a normalcy to the activity, with random spikes depending on anywhere from what executive order that comes without any forewarning to whatever obstacle may come up, but it's definitely not at the same pace as it was a month ago, mid-March. So we're starting to see some level of a leveling of activity. I'm continuing to still work on a lot of elements. Frank can talk about, he's now mask maker. He now has a new title other than Public Health Director, Commissioner of Mental Health. He is now the mask maker, so he'll talk about his mask making adventures. But Autumn out of my office is now also assisting with distribution of mask distribution to our county employees as we start to ramp up our supply to comply with the executive order. That's been a big issue to be worked on. I'm starting to shift away a little bit, working more on the budget retreat preparation for next week. We've talked about, and Amy's given a directive, depending, no spikes in activity, but having some folks report to their normal jobs for a half a day or two a week to try to get back into normalcy and some other routines. But obviously that's all up in the air depending on what happens that day or that week. It could all change really without much forewarning. So I guess maybe I'll turn it over to Frank and let him give you any more details or any specific questions because he's probably got more answers than I do.
Good afternoon, everyone. So just a kind of a disease update. You've probably been noticing that we're steadily getting 1 or 2 cases a day, and we haven't had a real big case day in a while, which is good news. We are continuing to see people get to the recovery phase as well, which is also good news. Our hospitalization numbers have grown a little bit over the last couple of days. I think as of yesterday, we were at 6 folks hospitalized. So the disease is still in our community, and it's still important that we continue to take the steps that we have been taking to prevent the spread. To talk about mask making, it has certainly been an adventure. We spent much of last week trying to understand what was happening in the community already. There's been a lot of amazing people stepping in and figuring out ways on their own to try to make masks available. What we were missing was some coordination of all of that. And so that's where the county has kind of stepped in. So after talking with the different groups we were able to identify, it made clear that there are a couple of groups that are going to continue to make masks on their own for a cost for their workers, hoping that it will help, subsidize some folks that are out of work right now. And that's great. We certainly will direct people that are interested and willing to pay to those groups so those can continue to operate. But we're committed to providing free masks to anyone that might need them that doesn't have the means. So to that end, we have worked with the group So Many, which was responsible for putting the blue boxes out. You may have seen around the county. We have taken over responsibility for those boxes, so we are now going to be doing the pickups. We're partnering with Angelo's Dry Cleaner downtown. So they are laundering and then heat treating all of those masks and then packaging them up. And we will be taking requests. A letter will be going out to businesses, hopefully today, giving them the process for how they submit a form to get to tell us that they need masks. Once we get those masks made and cleaned and ready to go, we'll give them a letter from us that says you've been approved for this many masks, and they'll take that to Angelos and get their masks. So that's the process that we're using for cleaning. We're also looking to stand up this week a larger scale operation similar to what's been happening in Bartles Hall with the surgical masks that CMC has been making with their volunteers. We went and visited them today to get a look at their operation. We had originally thought that we might cohabitate with them, but they've got a pretty big operation going up there. It's pretty amazing. And so we decided it probably wasn't good for us to try to squeeze in there. And so we're looking now to partner with TST BOCES and use their gymnasium. So Bridget, I, and a couple of others will be going over there this afternoon to get that set up. We have a list of volunteers from our press release that went out over the weekend. So we're hoping to have a soft opening on Wednesday over at TSD BOCES, where we start producing cloth masks. All the masks there will go through the same process. They'll go down to Angelos to be cleaned and heat treated, and then they'll be distributed to businesses as we create a supply. It is our intention to, when we have a large enough supply and have met the essential business demand, to move this to the general public as well. But we're obviously trying to prioritize those essential workers first. So once we have that worked out, then we'll figure out a plan for getting them and making them available to the general public. We've bantered around using our local elected officials in the different municipalities to help us find a way to distribute to their residents so they can get them right in their communities without necessarily having to come down to Ithaca. We're still working on all those details though, so more to come on that. The only other thing I wanted to mention, you may have been hearing about the state health department doing antibody testing. And I think there's been a bit of confusion that now that's widely available and anyone can get it and the local health department is doing it. It is not that. It is a study by the New York State Department of Health, and they are collecting samples from 3,000 people across New York State at grocery stores. So I believe that sample collection is slated to be done today. And the purpose for that is they're trying to get a representative sample to understand what the antibody levels are within the community. So just wanted everyone to be clear that that is a small sample study, not wide-scale availability at this point. And with that, that's my update, and happy to answer any questions.
Hi there, Frank. Thank you. We have Ann Corman first.
Thank you, Shauna. My audio, listening to it, is going in and out. Can you hear me okay?
Yes,
Yeah.
we can.
Okay, thank you. So thank you for the updates, Frank and Jason. So I had a couple of questions, I think mostly for Frank. So the first one is something that I asked about last week as far as replacing Nina Saley, the Public Health Preparedness Coordinator. Any word on having somebody do the role she was doing?
Yeah, we don't, as I said last time we talked, Nina was a one-person team, so there isn't a natural backfilling. I think really what we're looking for is to hear from those that have been working with her if they have continued specific needs, and then we'll try to fill those gaps. So if there's a particular need you have interest in, please let us know, and we'll try to get it met.
Okay, so you need me, and so I did write I thought a detailed email, but you want me to ask the municipalities again too, the specific needs they have?
No. We'll have that conversation with them. We talked to them last Thursday about it. We talked with them again this Thursday. So we'll take care of that. If you did send it, I apologize. If you could send it again to put it at the top of my inbox, that would be very helpful.
Okay, sure. Yeah, I have trouble keeping up on all my emails too. On the masks, I wasn't sure from the update, and that I'm so glad that you guys are doing a lot for the masks. I know that's a challenge in a lot of ways, and so I really, acknowledge that and appreciate that. And so the one thing I wasn't sure from the press release was how businesses or essential workers ask for masks.
Yep. So we're going to be sending out a letter probably today that explains all of that to them. We have an electronic form that they'll be able to just go on and give us their information and what their needs are. And then that goes into our spreadsheet for distribution once we have supply.
So that's going to go out to each individual business?
Yeah, we're going to do the same thing we did with the business letter. The last business letter will be using community partners like the Chamber and others, as well as the Human Service Coalition, to get to the nonprofits and get it spread that way.
Okay, great. All right, I'll let them know. The ones that asked me anyway. And the last question is, with the Bridges Cornell receiving the remote testing at their assisted living facility. I'm just wondering if you can update us on how that happened and what's going to be happening in the future for testing.
Sure. So Bridges reached out to CMC and requested the sampling, and so that was how that occurred. I have a call scheduled for tomorrow morning with the nursing homes and adult living facilities, and I've invited CMC to come be a part of that, to talk about what's available. I'm still trying to understand the logistics of everything that CMC is able to do and is willing to do. So I don't have definitive answers on exactly what it is we're going to be able to provide. There are a couple of things to point out. We're calling this essentially surveillance testing, right? So if you go someplace that doesn't have a known case, we're really testing to see if there's perhaps asymptomatic individuals that we would want to know about. Obviously, we could do that, and the next day the situation could be completely different, right? There could have been somebody that was incubating and wasn't yet testing positive. Somebody could have brought it in from the outside. So the importance of surveillance testing is really we've been dealing with the disease in our community for a while. We've been fortunate not to have significant issues in a nursing home, and we just want to make a check to see where we stand today. Whether or not we're going to be able to do that on a continual basis will be dependent on supplies, staffing availability, and a lot of other factors. So we're still talking about what this all means and looks like. But it does appear that we have an option now to potentially go into these high-risk situations and do some testing. I would also throw out there that anytime you bring somebody else into one of those facilities, you add risk to that facility because that's where the disease is coming from. It's from people bringing it in. And yes, they're taking amazing steps to prevent that from happening. But the reality is that every new entry creates new risks. So we have to be mindful of, all of the ramifications of what we decide to do.
Okay, thank you very much. And I'd be glad when you look at getting masks to more of the general public, I'd be glad to help in my municipalities.
Great, thank you.
Okay, I have Anna and then Deborah.
Just a quick follow-up, Frank. Jennifer Tavares put together a form for people who had the need for masks, essential services, to fill out. I put that in a daily summary after she sent that to me, and I know people have filled that out since then. Is that the form that you were referring to?
Yes, it is.
Okay, good. I just wanted to make sure. And there was the Cornell Farmer Program submitted a request, I think, for 500 masks for farmers and the whole farming system. I just wanted to make sure that got through.
Yeah, there's another gentleman that's leading a mask making effort that said that he was working on that. We're going to confirm that with them today. But my understanding is he made hundreds of masks already and is close to filling that order.
Great, thank you.
Deborah Dawson.
Thank you. Thank you for the work you're doing, Frank and Jason and everyone who's out there with you. I have some questions about testing. I was reading an article, I guess it was in the New York Times, that about the incidence of COVID-19 on an aircraft carrier, and fully 60% of the crewmen who tested positive were asymptomatic, which suggests, especially in the context of moving forward into some kind of reopening the economy, that we're going to need surveillance testing as well as antibody testing on a fairly substantial level. Do you have any sense from the state that we're prepared to do that?
It's a good question. I think you've heard the governor say that is part of his reopening plan, is to make sure that testing is more widely available. I would say again that we've been extremely fortunate here that CMC was able to stand up what they were, and the availability of testing to us is not indicative of how it is in the rest of the state. And so I think to a degree we are already a bit ahead of the game. whether or not that moves to wide scale surveillance of asymptomatic people likely will, some of that will be informed by the research the state is doing right now with their antibody testing. But whether we could do that tomorrow, probably not. But I imagine as we start to talk about reopening, we would shift our thinking to a different model, and certainly would do what we could to make sure that we could get as much information about the disease in our community as possible. So it's a lot of words to say I'm not sure, right? I think we'll do everything we can to be there and do what needs to be done, and we have a great partner in our community that's helped us so far.
Well, I do appreciate everything Cayuga Med has done. It just seems suggestive to me that, as an old person, too old to volunteer, for example, to pack food, that as we start to return to some kind of normalcy, maybe we should be testing older people or people with at-risk comorbidities who are asymptomatic, and there's no provision yet for us doing that.
So just the reason for doing surveillance testing would be to kind of understand the movement of the disease in our population. Those high-risk individuals, I imagine we're going to be asking them to stay home for a while, right, as much as possible, because you could test them today and tomorrow they could be positive. That's the issue with surveillance testing. So unless you're doing it almost every day repeatedly, it only gives you a snapshot in time of where they are. The reason we do the surveillance testing is to get a feeling for how the disease exists in our community right now, and whether or not we can begin to loosen up some of the stay-at-home recommendations or requirements that we've made. So it's going to take some thought about how is the most effective way to do that. And quite frankly, the most vulnerable aren't the first people we would want to test from a surveillance perspective. It would be those essential workers that are having the most contact with other people in the public, right? So that's the kind of thing we're looking at. We want to know in those populations how the disease is progressing, because they're the most likely to spread it because they have to be in contact with others because of their work.
So antibody testing would be much more effective.
Well, it's helpful. We don't know the full extent yet, right? Because antibody testing is super helpful if we know once you've had it, you can't get it again. But we don't know that yet. So that's part of the research that has to happen, right? We don't know for certain. So it becomes all of these testing things that we're talking about, they're fairly complicated, and the tests in and of themselves aren't the answer. It's what we do with the data that those tests reveal for us as a population.
Thank you. Okay. Martha?
Thanks, Shauna. Maybe this is a Jason question. And on the antibody testing, you don't know if somebody's recovered. You don't know whether they're still able to shed virus and infect somebody else. Is that right? Even if they're recovered, is that right, Frank?
Well, we don't know exactly how long you can shed the disease, and there is some evidence that the more sick that you've been, the longer that you could potentially shed the disease. And so there's that component of it. Really, the antibody testing is more about, do you have some immunity to the disease, right? Are you able to get it again? And that's really the main focus of the antibody testing.
And it would also help give us a better picture of what the asymptomatic community might actually have been. I mean, it's another way to look at the population. So questions about, really grateful you're working with the nursing homes and the assisted living facilities with CMC. I'm interested, Jason, you sent out a note to questions to the human service agencies.
Yes.
Do you know, are they going to be able to respond? And I don't know if any of them are on the call, but are they going to be able to respond about kind of what additional things they are doing? For example, we've dumped a lot of work onto 211. Like, we need to know for both sides of the equation, what are the additional needs beyond their expected scope of work?
Those questions will be asked to understand, how the response, how COVID has impacted them. So it impacted them in a way that they're no longer able to provide service, or impacted them in a way that they're providing more service or different service.
Okay, all right, because we've got to sort of try to get a handle on the big picture.
There's also a give and take that you have to keep in mind too. So while an agency under normal circumstances may provide A, B, and C, and under a crisis they may provide more of A but less of B and C. So it's kind of it's usually not a one size fits all scenario.
Okay, all right, well, I guess that's about it. I think most of my other questions have been covered. Thanks to you both.
Yep, you too.
Henry?
Yes, Frank, are the nursing homes, when you meet tomorrow, are they gonna only get surveillance testing?
I'm sorry, could you repeat the question, Henry?
Are the nursing homes tomorrow that you meet with, are they only gonna get surveillance testing, I assume?
Yeah, as long as there's no cases identified in their facilities, what we would be talking about is surveillance testing. It'd be testing in the absence of disease to understand what is in their population. If any nursing home had a case, we would do a contact investigation just like we do with every other case.
And do you plan on doing any other surveillance testing of anyone else?
We haven't gotten that far yet. We're starting with that most vulnerable population, and once we get it operational and understand what the capabilities are, if there's more capacity, we'll certainly talk with CMC about that.
Okay, thanks.
Great. And Frank, I had a few questions. I wanted to just ask, right now they're saying that 30% of the negatives are actually positive. Is there any way to go back and look at the deaths that we've had in our county to see if due to the symptoms that they had, that they might have in fact been positive?
No, you would have to be able to sample the body, and you have to do that within a certain amount of time in order to do testing. So the short answer is no, there's no definitive way to go backwards.
Okay, because I know that New York City just went back and established that they had an additional 3,700 cases that they marked as positive COVID.
Yeah, and that's partially because they were having those issues when testing wasn't widely enough available for them yet.
Okay.
But they were already monitoring those individuals for COVID-like symptoms. So one thing that we are in the process of doing is having the nursing homes and adult living facilities report all deaths to the medical examiner so that they can make a determination on whether we should take a sample or not. So we're taking some steps to make sure that we are capturing everyone that has it. And it is also important to point out that people die for other reasons too. And whether or not you had COVID-19 might not be the determining factor on why you died. And that's really for medical examiners and those professionals to make those determinations.
Okay. And then my second question was, my family went out to Taganic Park yesterday and noticed that there were quite a few people on the playground still. And there were very small signs that were spread out. And after about 30 minutes of kids on the swings, a state park police did stop by and walk out and get the people to get off the playgrounds. I was wondering if there's a better way that we can offer some signage, for example, as people enter into the state parks or around playgrounds, so that they know right off the bat that they're not allowed to be on the play structures.
Yeah, we can certainly talk to our contact at the state parks, but they are state parks, so we don't really have jurisdiction over them. So we'll pass that along and see what they come up with. Great.
Is there anyone else? I see Martha, your hand is up. Is that from the last time? Okay, I think she said she's good.
No, I do have another question.
Okay, yeah, go ahead.
Thanks. Yeah, it's something like yellow crime tape around the playgrounds would probably, I mean, because the kids have to like see it so they don't demand to go,
These were adults on the playground.
Oh, great. Okay. My question is about surveillance testing, and do we have the capacity for follow-up with contact tracing? Because that's the other part of it, right? We need, the more people we test, the more capacity we need for following up. Is that right?
Yeah, so the contact tracing is all being done by the health department. So anyone that tests positive, we then do that contact tracing. We have been using the drive-through if they are healthy enough to go and get tested at the drive-through. If the situation arose that they were not, we would have the ability to go out and sample them where they were.
So if we increase testing, say if we do, hundreds more in nursing homes, or as Henry suggested, as we try to ramp up so that maybe if we can open up the community a little bit, where would we find, how much capacity do we have for that, and what would we do to increase that capacity if we need to?
Yeah, we have pretty significant capacity with only having 1 or 2 cases coming in a day. There's still plenty of capacity in our current staffing. When we were getting in the dozens each day, we did need to bring in all of our nurses and get them trained on how to do contact investigations. So we've got quite a bit of capacity within the department to be able to do that. And contact tracing is really interviewing. It's the core skill that you need, and we would be able to get more folks trained up if we found ourselves in a situation that we needed to.
Okay, great. Thanks a million. That sounds good.
Deborah?
Yeah, just one last question on testing. Is there actually a reliable antibody test out there somewhere?
Yeah, and it's becoming more readily available. My understanding is that some of the private laboratories are able to do it. The challenge is that we don't know what that antibody test means. And so going and getting tested will tell you that you had the disease, and sure, that's good to know. But from a public health perspective, we want to know if that means we're beginning to have herd immunity developed. And so as it becomes available, we're also going to want to be developing studies that are useful in telling us what that data means, other than for that single individual. Right? Obviously, it's good for them to know, but for us, we need to know what the totality of all that sampling would mean for us as a community.
Thank you.
Glenn, Amanda, and Dan, did you have any questions? Okay. Henry, Anna, Mike Sigler, Leslyn, or Annie, were there any questions for Frank? Okay, I see head nodding. No. Okay, let's move on to our presentation, and I would like to welcome Rachel Besner-Kerr, who is here on behalf of the COVID-19 Tompkins County Food Task Force. And Anna's here as well, representing.
Thank you very much, and I really appreciate you giving me a chance to talk. I haven't prepared a PowerPoint, but I will try and make a summary of what we've been doing brief, and then what I'm asking from the county clear. So I'm normally a professor at Cornell. I teach about food systems. I'm a sociologist, and I've been teaching different food courses in the last 7 years. So I've gotten to know a lot of the different organizations working around food in this community. And I'm also on the board of Groundswell Local Food and Farming, in case you're wondering why some professor has any contact with food issues in the county. But started a few over a month ago to hear about rising needs related to the food system, both on the distribution side and on the production side because of COVID-19. And so I got in touch with Rafael Aponte, who's on the Tompkins County Food Policy Council, to ask, and he's also a farmer, and we've worked together before, to ask if he'd been hearing anything. And he'd also been hearing about rising food needs. And so we decided to start to coordinate to find out what those needs are and to see if there needed to be some sort of coordinated response. we got in touch with Anna around that time and started to reach out to many different organizations within the food system. The Food Bank, United Way, 211 on the emergency side, but also on the producer side, the Ithaca Farmers Market, different farmers, Cornell CCE, the Cooperative Extension, and restaurants and the food businesses and how they were being affected. And what we were hearing was that there was a dramatic rise in food requests on the emergency side. The requests have doubled for food needs compared to pre-COVID. And those have been both the food banks of the Southern Tier in general, but also food pantries like Groton and Lansing and Infield have seen, in some cases, more than doubling or almost doubling in requests for food needs. So that's one issue that was coming to the fore. At the same time, volunteers, most of the volunteers working on the emergency food response side are over the age of 65. So their numbers of volunteers had dropped because a number of older people who were volunteering didn't feel they should be involved in food distribution anymore. So those were some of the needs on the emergency side. On the producer side, producers were struggling to transition from a farmer market direct sale model to an online distributing to home model, very different model for many farmers. And they were also seeing a surge in demand. So a lot of people trying to transition to community share for those who can purchase food. So those in our community who are able to purchase food, they were wanting to no longer go to the farmer's market, and they were maybe trying to reduce their trips to the grocery store. So they were looking for direct delivery. And a lot of farmers were struggling with that. They also had labor issues sometimes. So concern with their farm workers getting sick. There's been a rise in the number of farm workers who have COVID-19, not just in Tompkins County, but in other counties in the region. And so on the farm worker side, when they did get sick, concerns about where they would stay, because they were often staying in trailers or other types of mobile homes where they couldn't quarantine themselves. So a whole host of issues related to the food system. And we decided, after consulting with all these different organizations, that we wanted to form a food task force, and we did so. And that food task force has over 65 organizations on it. And the idea is not to replace the work that's already being done in the community, but to actually just coordinate and communicate, share information about needs, about resources, and coordinate responses. And we've formed 3 different teams within that task force. The distribution team that's addressing rising food needs in the community, and also trying to make sure we're not increasing the transmission of the virus during a crisis. And health and communication team, excuse me, I'm just going to unplug. Hard to present when your phone's ringing. And health and communication team that is trying to make sure we have the most up-to-date information on safe food distribution, and that is making sure that those people in food business and food production and distribution have the necessary PPE for their use. And then on the production side, we have a production team that's both looking at the short term, addressing, helping producers transition to more online and coordinated hub sort of distribution. And also those in the community who are interested in the medium term in growing their own food, or in growing food for others who are out of work and needing fresh produce. So groups like Ithaca Children's Garden and other people and organizations who have land who want to make that available for sort of a victory garden or urban garden to try to address rising food needs, and also in anticipation of possible supply chain disruption because of COVID-19 across the country. So this task force we have team leads for each of those 3 teams, and we have a coordinating group, and the coordinating group includes City of Ithaca and Tompkins County representation. And we have weekly calls of all those 3 teams plus the coordinating group. And we have opened, Anna was able to secure the Green Star space for us. And that was so that we could coordinate and have a centralized hub for this increased distribution, because the food bank has never had this level of food need before, and they've never done distribution on this scale before. They've been distributing 600 boxes a week, and they were working up in Lansing at the alcohol and facility. So they were very excited when we had the Green Star space given to us for free usage as a task force. And just starting today, we've had the food bank have their pallets delivered, and there's a group of 6 volunteers with safe distance apart packing boxes for distribution. That hub will also be a place where producers on a different day are able to bring their produce to, if they don't have a means to do community shares themselves. And Silas Conroy, who is at Headwater, is going to be helping coordinate that on the producer side. And some producers are really interested as well in donating some of their produce for the food bank needs, for the identified needs in the community. And Friendship Donation Network is also seeing a surge in requests for food and in donations, and they were very excited about having refrigeration opportunity for storage of their food. So they're also going to be using that hub. So tomorrow we're going to have a virtual meeting with Silas coming to look at the space to plan the coordinated use of that space. And 211 will be the place that we've been directing people, and 211 and Kathy Schlatter, the HSC, is one of the organizations involved in this coordinated group, this task force. And so 211 will be the place that we receive calls. What we've heard from the United Way is if we see an ongoing increase in requests for food, because United Way has also been involved in doing direct delivery to those households who aren't able to leave their homes and aren't able to get to places to receive food. They've coordinated with Food Net, Meals on Wheels, and other transportation groups who are also on this task force. But they have said that they may have a need for increased volunteers for driving and for calls. And so we're going to be coordinating around having additional volunteers for remote calls, for managing remote calls. And so that's a summary of what we've been doing and what it looks like. And I don't know if, before I get to my ask, if there's anything that Anna thinks I might want to add, and if people have questions.
No, I think that you've summarized it quite well. I'll just wait for questions.
Okay, so maybe I'll give my ask. Shauna said we need an ask, so I like this language. I do most of my research in Malawi, where we have to write research proposals, so I'm not used to that language. But our ask of the county is we would like to have one person redirected to work to help coordinate this task force, and to help with things like driving and distribution activities. We are relying on this range of organizations to put forward their staff and volunteers, but it would be really helpful, and we see as really important, to have one person redirected from the county as our local government representation to help coordinate this work and to help with distribution activities. Right now, you're looking at the coordinator at the moment. I'm your volunteer labor. I've been able to do that for now, along with Anna, Raphael, and Kirby, but that isn't sustainable for what we anticipate to be at least 2 more months of this increased need. And really, it might be longer than that. We don't know. Everyone knows that there's a lot of uncertainty about what is going to happen going forward in terms of food needs for the county, with rising rates of unemployment and the associated loss of income for people. We have heard from the United Way that they will anticipate needing help if we continue to see this rise in distribution requests. And so that's why we're coming forward with this ask. We've been putting together a team, and some people are able to do this work as part of their regular job, but others are not. We really feel we need this one person redirected, both to have really solid representation from the government in this role of coordinating and being at the center of that coordination as the backbone for making sure we don't hit a food crisis on top of a health crisis. And because we have, we don't have anyone who said, I can do the central coordination. We've had people say, I can help with the production team, I can help with the health team. But when I've asked the food bank, would someone from the food bank be able to do central coordination of distribution? They said, no, we're completely tapped out. I've asked the Friendship Donation Network, would you be able to do, Megan Sheen Rosen, the coordination? No, tapped out. I asked Silas Conroy, who does coordinates at Headwater. He said, no, I can't do that. They're already doing the work within their organization and their networks around food distribution, and no one feels they can dedicate the time to coordinate this task force. But all of them have said, either verbally or in written form, that they feel this task force is extremely useful, ensuring that we're kind of staying ahead of the curve, if you will, of the rising food needs that are happening in our community. So they're really trying to get ahead of it. And this coordination and weekly check-ins is extremely helpful in making sure that we are not duplicating each other's efforts and that we're coordinating. I'm sure some of you are aware that at the early stages of the pandemic in our community, there was a grassroots effort and coalescing around trying to help neighbors called Mutual Aid and other groups. And because they weren't aware of some of the resources in our community like 211, and because there wasn't that coordination, some of them even started a call-in number and started to do door-to-door distribution. We want to avoid having, a second call-in number, which is confusing in our community, and having distribution without the proper, health procedures in place. We really want to avoid having, it's great to have grassroots volunteer efforts, but we want to have that in a coordinated way so we don't have duplication and so that we don't increase transmission of the virus through food distribution. So that's one ask. If possible, we could use 6 tables. We don't have any tables at the Green Star space, or we have 2. And the food bank said it would be very helpful to have 6 tables. And if possible, a box truck to deliver 12 pallets on Friday. But I understand that may not be possible. And we're still reaching out to find out if we can get a box truck because there will be a community food distribution on Friday in Dryden. And we're going to be having, the food bank's going to be giving boxes to families and they just drive up. So no one has to, have it. You just open your trunk and the box gets put in. And we need a truck for that. We haven't found one yet, but that's the most important ask, is the redirected person. And so with that, I end my ask.
Okay. Why don't we actually go to Jason? Because I think this is a very gray area on the staff and who is directing the staff. And so I would like Jason to pipe in here. And I also, I wish that we did have some of our other providers here to talk about the need, because that's been my concern. And that whenever I speak with other local providers, Human Services Coalition, other people that are in the field, every single one of them have said that the need is being met. So if we could hear from Jason first, that would be great.
Okay, I do have Jay and I have Amy here as well, and Frank, just to kind of chime in. Thank you. Thank you, Rachel. It's nice to meet you, by the way, in an odd way. I think a lot of the question is around what need has there, what need is there, and what need has been met, and then the question of how do we go about ensuring that the need is met. And I know we have been working with FoodNet, the food bank, United Way, a lot of the players that were mentioned about how to ensure that the immediate emergency, which is getting the food to the individuals that need it, is being met. You know, I could have Jay talk a little bit about some of the details of what's happening. I know just to talk about the immediate issue, the box truck issue, I know that's been resolved. I think we helped them get a box truck, or how they got a box truck.
Yeah, we put them in touch with Finger Lakes Reuse, and I think that should work. I just checked in with Randy Quackenbush just to confirm that
Jay's over
did
here.
work. So
Yeah,
I know,
so Randy said it's they heard from Reuse, but it's not as of 2 seconds ago, there's no box truck available.
so a lot of our work has been helping these agencies meet the need that they have and continuing to allow them to provide their level of service. So, you know, several of the things that were mentioned that I think are probably important to try to understand the difference. Several things that are going on. One is when the emergency happens, in order to ensure that the individuals receive food, has been our primary response. So we work with multiple different partners, the school districts being a big part of them, and their ability to deliver food to families. And they've expanded that to not only food, but to other goods, as well as families adjacent to families in need. I don't know what the numbers are exactly as to how many meals have been delivered, but you know, we've supported them in their efforts. Food Bank obviously works on providing food wholesale and then distributed through another way, and I believe United Way is assisting with that, as well as Food Net. Now, I do know that we've also provided some staff when drivers are needed, as well as a probationary supervisor to assist with some coordination. Is that correct, Jay?
yeah,
So-
we had 3 or 4 drivers for the event happening on Friday to deliver food to them.
Okay, so we've provided some support based on that event and that need through vehicles. So I think what's happened over the course of the past month is our involvement has gotten more frequent in helping facilitate and coordinate resources amongst the different groups. And I would imagine that'll continue as this continues to evolve and need is either increased or decreased, or nuances are created to improve the efficiency of the delivery of the service. You know, that's to the extent of our involvement to date. And I guess the question I'll ask Jay and Amy this is, you know, have we identified more need that isn't being met, or if there's an instance, for example, a circumstance where you know, if I look at the drive-through where we had an issue where folks didn't have transportation needs, we would help resolve that transportation need. Or the instance of masks not being made, we, you know, assisted in finding a way to get masks produced and distributed. So to that extent, we support those agencies that already have a structure in place to provide, in this case, food and food delivery. To the extent that we can continue to support it, we will. And I guess we deal with it on an as-need basis as it continues to grow and it continues to be a piece of the response. I don't know if Jay and Amy, you want to add anything to it. I mean, I know we have some statistics about, you know, what's been delivered to date. And I know 211 has been a big part of ramping up their advertisement and publication, and really you've got now a nuance in that you have probably new families that have never had the need for food, but now have the need for food. So how do we ensure they get that information and connected with the right resources? Jay, I don't know if you want to add anything to it. Not this time. All right. So I guess trying to understand, you know, what our role is here. We continue to work with all those partners and facilitate and support them as they need. And if there's staff that needs to be supported, we either find them the mechanism to do it or we provide it ourselves. We have not been to date, at least as far as I know of, and I don't know that we would right now. You know, we have not been involved with producers and connecting producers to distribution. You know, that's something that we've been involved in, nor have we been involved in their grocery stores and their distribution methods either. And I know we have not been involved with the farm worker issue in terms of farm worker healthcare and all those lines.
I see a hand up from Amanda.
Yeah, thank you. Thank you, Rachel, for telling us more, and thank you, Jason, for that response. I guess I feel a little bit confused, like you're excuse me, you're asking for sort of a worker person, but you're asking for an admin person who will also like look at the bigger picture. And I mean, what you're describing would be great. It sounds like a full-time job for somebody to do. And my sense is, I mean, Jason didn't say this, but my sense is that, you know, it's kind of an undefined position that who would we just turn around and say, you can go do all this now? I mean, I don't really, as far as I know, have somebody working in the county who knows about food systems, knows about, you know, farm production, knows about all that kind of stuff, who we can just say, you know, you can go over here and work on this now. I mean, Jason can correct me if I'm wrong, but it seems, you know, that is a really big ask. And it's probably why lots of other organizations that you've asked have said, we're just strapped right now. You know, we don't have we don't have somebody to give you. So that's sort of my first thought. I guess, you know, I'm not in touch with everything, but I do know there's a lot happening, and I would want to see, you know, some data or some more factual information that says, you know, here's what FoodNet's doing, here's what HSC is doing, and here's the people who aren't getting served. You know, some actual data that shows, you know, like, I mean, I'm sure anecdotally there's lots of people who don't have enough, and I'm sure that's a reality. And I think, you know, it's great that you're trying to connect all the dots, but and as you're saying yourself, like, I'd hate for it to be overlapping with what's already happening. So I guess for me to want to support like redirecting somebody to a sort of amorphous position, I just want more data. And I know that you're all, you know, volunteering and spending your own time, and you know, I guess that's hard because we all are doing a lot of extra stuff, you know, right now. But thank you for working on it all.
Can I respond to that? Because I didn't prepare a PowerPoint, but I did give data. So the food bank has told us that the numbers have doubled. I am not saying that food needs haven't been met. What I'm saying is there is a need for coordination to make sure that we're addressing needs, because we're in an unprecedented situation where we have a health crisis and we're trying to prevent a food crisis. To do that, we need to coordinate. So we have heard from the food bank that they've had a doubling of needs. That's a data point. We've heard from the Groton. So, I mean, I could provide the data we have collected from our partners. So Groton has had 40 families this last week. That is, I don't have their COVID number, but they have said that it is much more, because they haven't always collected data on a weekly basis at the food pantry, but they have said that is many more families than they have normally had. Enfield had 410 households last week and 415 households the week before, up from 210 before COVID-19. They've also had 27 home deliveries, estimated from 4 per week pre-COVID-19. That was 27 home deliveries last week. Lansing had senior citizens home deliveries increase from 17 to 27 this past week. And they have served 40 families at their pantry in Lansing. 90% are new to the pantry. They anticipate increased need for the next pantry. So, and we also know the schools are delivering. In Dryden, 200 boxes, Newfield, 80 boxes, Trumansburg, 75 boxes, New Roots, 10 to 20 boxes. I don't have Ithaca County, but I know I think it's 600 to 700 boxes. And we've heard that Friendship Donation Network has served about 100 families in rural programs. And those programs have all run out of food during distribution. And we have heard from the FoodNet, Meals on Wheels, and United Way that they have delivered 138 boxes in the last few weeks. Those are all increases from previously. So that's the data we've collected. And in terms of what person we are asking for, you're right, it is a mixture. We're trying to get funding to fund a coordinator because we would like to hire someone to do it for the whole system. But on the distribution side specifically, we do need someone to help with transportation and distribution on a regular basis and be helping to coordinate the use of the space. I don't anticipate that you have someone in the county who has this, broad food system knowledge, but I do think you might have someone who would be able to help with distribution activities that are related to this coordination of the task force. And what we are not saying is that we aren't meeting the needs. What we're saying is all of the organizations we have spoken to, United Way, Food Bank, FoodNet, Friendship Donation Network, and on the producer side. And the producers, remember, there's this connection of trying to get some of the fresh food into the food bank distribution. All of them are saying that this coordination is helpful and it is helping them meet the needs. And in order for us to be ahead of the curve and not have a food crisis down the road as more and more people are out of work, is this coordination that is necessary. So that's just to answer your request for data. These aren't anecdotal statements. They are statements from the organizations that we're working with and that we're meeting with on a weekly basis.
Okay, I have Martha.
I also wanted to note that the idea of having a person redirected from the county, that comes from other counties that are doing this. So we've looked at other counties to find out what models are being used. And Schenectady County had a person redirected to do that coordination. He didn't have, food systems background per se, but and it is his full-time work right now. And they have a central call number, and they have a space where they're doing the distribution. And so we look to that model to see that it is possible for someone to be redirected from the county to do this work. And they may not know much about the food system to begin with, the whole picture of the food system, but they'll learn quickly. And I, for one, had limited knowledge of the emergency food system side at the beginning of this crisis. I now know a whole lot more. I knew much more about the production side and around the nonprofit side than I did around the emergency food side. So that's partly where we get this idea of redirecting a person.
Martha?
Thanks. And Rachel, it's impressive, and it's really wonderful to hear, but I'm a little, there might be nervousness that you sense from the point of view that we have systems already, and they're not meant to address this kind of crisis perhaps, but I'm trying to figure out how existing systems like our SNAP program in DSS, where does this fit? I mean, we already do have a way to support people who are food insecure. That's one issue. Other counties may not have the kind of nonprofit, FoodNet and food, Meals on Wheels, et cetera, those kinds of institutional assets that we already have. So comparing counties is an imperfect, I think, analogy. I'm also wondering, even though it seems like there's been so much need identified, I'm also wondering about, is there any proactive effort? For example, I'm thinking in my district, there are a lot of mobile home parks. I don't know how connected those folks are to what's available, whether they even have internet and know where to look or where to call support. So, and then finally, I'll just toss out, we're hearing, I've personally gotten requests from a couple of Cornell students, hey, I'd like to help. Is there anything I can do? Institutionally, I've heard that Cornell is trying to match up students with particular initiative. So I don't know if there's some resources there as well. So I guess my questions are, how does this not duplicate our SNAP system, excuse me, in reaching out to places like mobile home parks? And are there Cornell personnel or students who might be able to help?
Thanks for those questions, Martha. Let me start with the Cornell one first. That's an easy one. You're looking at a Cornell personnel. I connected lots of Cornell personnel to the task force. So Cornell Dining is involved, Statler Hotel, and the vice provost for international affairs, the person who coordinates the food pantry, because they started up a food pantry in GIAC. So they're involved. As far as students go, a number of students have also approached me, and some of them helped to clean the space last week to get it ready for use this week. But more long-term, what we're trying to do for volunteers is have them go to United Way so that we make sure that the volunteers, if they're involved in driving or packing boxes, that they meet the health standards that we need to have them meet to make sure we're not increasing transmission. If there's an increased need for 211 remote calls, we want them to go through United Way as well, so that we can make sure that we have the right folks to do that kind of work. We do have one Cornell graduate student who may be helping with the logistics of organizing the Green Star space, but I don't think that takes away from us needing someone from the county, because Cornell students have mixed time availability, and sometimes often they overestimate how much time they have available. I'm speaking from direct experience here. So I don't think that would be the person you want to rely on for coordinating a task force that's trying to address food needs in the county. So that's as far as Cornell goes. Mobile home, very good point, and something that we discussed on the distribution call last week, a lot of brainstorming about how to reach not only mobile homes, but in general in rural areas and other places where there may be less internet usage and less awareness about resources. That's a priority. And Jay has said that not Jay, but Renee, who is part of Tompkins County Health Department and who's on the health communication team, has said that if we want to produce flyers for distributing to certain regions that we don't think are being reached, we can do that. So we agree that that's really important to make sure we're reaching out to those people who are not sort of connected or aware of these resources already. In terms of duplication of SNAP, again, I'm not talking about an organization that is, and in your initial response, that there's more NGOs, there's more nonprofits in Tompkins, so maybe there isn't a need. That's not what we've heard from the nonprofits. And the other counties that have had a coordinated response also have nonprofits who are doing this kind of work. Tompkins isn't unique. I mean, they may have a lot of nonprofits, but they're not unique in having nonprofits. So Schenectady had lots of nonprofits involved in that coordinated response. It's not that we're talking about the task force doing all this work. It's the task force bringing together all the different players who are doing this work to make sure that we're not duplicating and to make sure that we're sharing resources and information. So that would, a task force allows to avoid duplication. It doesn't duplicate. That's the whole idea. You're having weekly calls with everyone involved in distribution to make sure you're not duplicating. So in terms of SNAP, I don't know how to answer that question because I don't know enough about SNAP. But I wonder if Anna, you could help answer that question.
Oh God.
Deborah seems to not want my response to this, so
I'm sorry. I just, it just seems that we keep hearing about this. And when you talk to different people about it, you get different responses. We hear that the needs are being met, but there's a need for coordination. And I'm trying to understand what that coordination would look like. It's easy to say, we need somebody to coordinate this, but what does that person do day by day by day, aside from these once a week phone calls? You know, it sounds like it's a major job to get all of these people working on the same track. You're going to bring a person in who doesn't know the players, and they're supposed to make magic happen. I just have a really difficult time understanding, A, how this is going to work, and B, how we're going to justify this when we have so many demands on the county created in no small part by this particular crisis. And we're trying to figure out how we're going to gather the resources to make any of that happen. You know, I hate to be the bad guy and I hate to be the biatch in this situation, but I think this is the underlying resistance that you're encountering. You know, Anna, you've brought this to us several times, and I appreciate your passion about this and I appreciate your commitment to it, but we don't all share that particular passion and commitment to this particular piece of the crisis. And that's something that y'all have to understand, you and Rachel and all the other people that are doing this really good work. There are just going to be so many demands on us. I don't know how we're going to meet them. This is just one.
So Deborah, just to respond to that, those are all very legitimate points. The reason that I reached out to Shauna last week is because it was really important to me that anything be formal and it be through committee so that everybody could hear it and not through me. You know,
I understand
an opportunity to hear from other people in the task force. So, you know, up to now, yes, of course, I'm passionate about it, and you know, I'm putting my own separate work into it, independent of this, and I'm fine doing that. But if there was going to be an ask of the county, you know, I wanted it to come from someone else who's working in it, and I wanted it to be formal. So I just, you know, that was the reaching out to you guys last week and having you get involved and hear from Schenectady, so that, you know, it wasn't sort of a pet project on the side, that it went through committee, that went through the formal process. So, you know, I very much respect the challenges. This isn't sort of like, let's keep bringing it over again and over again until you're sick of hearing it. It's more of, you know, let's follow the formal process and channels and have it be a formal request. And then whatever responses people feel, you know, it's legitimate. We have a lot of pressures and a lot of things that we are being pulled and being asked to do. You know, this is one of the many, you know, making sure that people are food secure. So, you know, it's really collective priority, and that's up to committee, you know, so having it go to you guys. Just to answer the SNAP.
You know what, Anna, why don't we, Kit is here. Why don't we have her actually answer the SNAP?
How it's different. Has Kit been here to hear this, what Rachel's talking about the whole time?
We can't hear you, Kit.
Better?
Yeah.
You hear me?
Yeah.
Okay. So I have heard most of it. I lost connection a couple of times when you were talking, Rachel. So I'll try to say, I'll kind of try to give my best answer. And if I'm off target, let me know. I think that I guess the best I can tell you is kind of what I know from the end of this. From my end of this, I'm not sure I can speak to exactly what you're proposing, Rachel. What I can say is that I think most people are aware that SNAP benefits have been extended currently, that people are going to be getting increased. Most people are going to be getting the maximum benefit. The people that have been on caseloads currently, they're going to be getting the maximum benefits that would be eligible, that people would be eligible for through SNAP. So they're going to see an increase over the next month or so. And the state has come out with that, and I think that people will benefit by getting more money in their SNAP checks to be able to, or their SNAP cards to be able to go out and grocery shop. The other things that we have done is we have coordinated some at DSS with places like Loaves and Fishes and the Salvation Army, and we are providing through them some meals to needy families. I know that that there are folks that have increased need right now. I don't have a way to say that all of the need is met. I think that there are a number of ways that coordination efforts are happening. It is not, I don't think it's always centralized, but I think that there are a number of efforts going into planning and trying to coordinate around a lot of this. So I don't know if that information helps at all. We have done
so Loaves and Fishes is involved in this task force.
Mm-hmm.
So if that's one of your partner organizations, I think in terms of the SNAP benefits, that would just determine who calls in, so if the SNAP benefits increase, and maybe there's a decline in requests from the food bank. That hasn't happened so far, but it remains to be seen whether that affects the requests going forward.
One of the
actually, can I just clarify? Actually, it's not dependent upon, the SNAP increases are not dependent upon people calling in and requesting it. They are universal accelerated benefits through the state. The state is basically taking the existing caseload, and they are moving forward to extend benefits and increase benefits. So people don't need to call in. We are seeing a tremendous increase in people coming in and applying for SNAP benefits. Our SNAP requests have gone up about 4 times what we typically see. So our caseloads are rising, but we are able to meet that need. Currently, and we're serving those folks. So I think that we will see going forward people getting those increases in benefits.
Right, and I would just add what you're saying, Kit, what we were seeing in our conversations and the task force conversations is exactly what you were identifying, the increased need and people applying. The concern that people have is those people who are the most vulnerable and on SNAP benefits may be getting the SNAP benefits, but because of the way the federal system and the state system is, you have to physically go in. You can't use SNAP online and have it delivered. SNAP and the food stamps, the WIC checks. So the question in those contexts that was brought to the task force is, fine, they're getting them, but are we able to reduce congregation of people who may be in the most vulnerable population so that it can be coordinated to get the food distributed out to them? So that was the missing piece in the context of SNAP, not whether or not they're able to access the SNAP support.
Sure, and I can't speak to all of, obviously all of the county who are receiving SNAP. There's going to be a large number of people that need to go out and access groceries. But we have, for folks that are on our caseloads, we are doing as much delivery and support as we can around some of that that food need. And we have set up a number of folks to receive meals through things like Loaves and Fishes and Salvation Army to be able to get some deliveries so that people don't have to go out. And certainly the shelter population is also being served by some of those. But yes, I think there's probably always need out there that's not met.
Okay, everyone, we are an hour and a half into our meeting, and I have Dan, Henry, Ann, and Martha. So if we could keep our questions crisp, that would be great. Let's start off with Dan.
Before we go to Dan, can I respond to Deborah's question about what this work would look like?
Mm-hmm.
and what it looks like at the moment is there's 4 calls a week that are coordinated. And in between those calls, there are emails to different people that arise out of the phone calls, out of the Zoom calls. So the truck is an example of the kind of thing that I've learned about that we need for Friday, and the tables and things like that. But in terms of making the magic happen, the good news for any county staff who get, if we were lucky enough to have a county staff person reassigned, is we've already got this task force operating. It's already been operating for a couple of weeks. So we have team leads for the different groups. We have coordinated calls. We have a list of everyone in the group. We have their contact information. We have listservs. We have a website, a Google site where we share documents. And so we're already functioning in that sense. And so some of that magic already happened. People are maybe in a non-crisis circumstance, it's harder to get people to coordinate across organizations, but this crisis has brought out some really good sides, and people are willing to coordinate, and they have said they appreciate the opportunity to have this coordination. So some of that wouldn't be incumbent on whoever got reassigned.
Okay.
I don't know if that helps.
Thank you. Dan?
Thank you. I think you're hearing some concern maybe other people share this point of view that trying to invent something in the moment is not maybe the best way to go. I feel like I would want to hear from the agencies that we already work with, and there are quite a few of them. And if they're saying this is what we need, we're not able to do this without a little extra help, and here's what we need, then that would be something different. But I haven't heard from them yet. And I just want to say I'm not sensing a lot of support from this committee, and I really think we should move on. I know for myself, I can only stay a few more minutes, and we still have some business to do. So if there is somebody that's saying, yes, I would want to take action today, then they should speak up soon. Otherwise, I think we should probably move on.
Sounds good. I'm going to look at committee members, and it appears that there are no hands saying we should continue the conversation. Anna, if you can make it short, please.
Yeah, I just wanted to know, Dan, was that a request? Do you guys want to hear from the agencies, or do you want to just, I'm happy to do whatever you guys want, but I'm curious if that was a request, and if that it would be something you would all be interested in.
I think what I've heard is that it would be helpful for some of us to hear from the other agencies that are partners, Human Services Coalition, the Food Bank, FoodNet, because I know that I've had conversations with them, and they have said that we're meeting the need, and that, I think right now we're in survival mode, and we're trying to figure this out. And right now, while I think the system that you're talking about sounds like a really great system, and maybe if we weren't in coronavirus mode, we might look to that system for a long-term solution. Like, I just am not sure right now is the time to recreate the wheel or, start something new. So, we could spend some time at the next HHS meeting inviting those partners in to gather more information. What do people think? HHS, what do you think?
That's another month. I'm trying to get a grip on how urgent and immediate this need is, among other things.
Do we want to do a special?
I saw Jason's hand up.
Yeah, Jason.
Yeah, I did too.
Oh, Jason, go ahead.
Yeah, I'll say this. I think there is a little bit of a mix-up between what is part of the emergency response and what is part of the greater food system network. And I think that's where we're getting hung up a little bit here. So I will say this, you have some strong partners that are providing food and food delivery and access to food in several different ways. There are elements of what was discussed today that we are not addressing, primarily around producers and linking producers up with new distribution methods. That may or may not be in the near future, but as of right now, the immediate response is getting those, whether it's food bank, food net, whether it's the school districts or any other providers, the needs that they need to continue to provide the services they need to continue to provide. And as that continues to evolve, what we've seen is our role has become more involved and more, it's increased and more of a coordination and a little bit of facilitation depending on the request and the need. But I do think that there's a mix between the immediate response to the crisis and working with the channels that are established now, and as well as a greater food policy system approach. So I will tell you that none of the partners, Food Bank, Food Net, none of them will say that this is a bad idea. Not all of them will say, yes, we need this. And that speaks, I think, to the bigger coordination on a community-wide scale. I will say I'm a little conflicted as to how we'll go about doing that in the middle of a crisis and whether or not, yes, the increase, there has been a doubling in need. I agree with that. The numbers that we have will support that, similar to what Rachel said. Is it being met? I think it is being met. Are we having obstacles? Yes, and when we have obstacles, we solve those issues to move on and overcome that. To speak about the greater policy, food policy issue is, I think, a much larger discussion. One we're more than welcome to be a part of. So I don't want to think that you're not. I don't want you to think that leaving this conversation that need is going to be met or that it's going to be abandoned, because that's not the case. As was the situation with masks. If there was a clan of mask makers that existed, we would be saying, yes, make masks and bring them over here. There isn't. So now Frank is the mask maker. He's the mask whisperer, actually. Oh, he's not here. He left. He's the mask whisperer. But we have been more involved in that because there isn't an established system to produce masks and distribute them. And should we get to that point with food, which I don't think we would, but if we would, it would be much more, we would have a greater effort in coordination amongst those partners as well. So I just want to say that this isn't a circumstance where there are folks that needs aren't being met. Needs have increased quite a bit, and they are being met.
Well, why don't we plan on keeping the conversation open? Anna, if you can provide us with any other information, please do so. And we can circle back at our next HHS meeting.
Yeah, and I had suggested she has emails from some of the agencies, so if we compile them into one document, I can always forward that to everybody.
Sounds good. Okay. Glenn, did you have anything to add there? No. Okay. Okay, let's move on. Rachel, thank you so much for coming in today and talking to us about this. Appreciate your volunteerism as well.
Thanks for letting me come to your meeting.
Yeah, thank you.
Thanks, everyone.
Okay, we have Kit Kephart, who is the DSS commissioner and is joining us to talk about Code Blue, as well as to give a department update. Thank you, Kit, for joining us.
Sure, absolutely. Code Blue update, as most people recognize, Code Blue is a program that is temperature based. So when it is 32 degrees with wind chill, we have the ability to have people sheltered based on the temperature. Typically, we start to kind of think about that temperature changing, getting into a range where we're not going to be sheltering people after on or about April 15th. So we met that date last week. However, we did not end up having to not shelter anyone, because the truth is that it snowed. It snowed for a couple of days. So the temperature stayed in a range where sheltering continued. But we are going to see that starting to wrap up. We have been working very hard to really get everybody who is being sheltered on Code Blue to apply for THA. So THA is the Temporary Housing Assistance. It is a part of the TA, the Temporary Assistance Program, through our state partner, OTDA, the Office of Temporary and Disability Assistance. And we, as of the beginning of last week, we had about 84 people that were being sheltered through THA. We had 32 Code Blue folks. And by Friday, all of those folks, except for about 12 people, had transitioned over to THA. We really, I have to give incredible credit to our special services staff at DSS. They have really worked hard to reach out to people, to work with St. John's, to work with several other community private agencies that are working right now to try to get as many people as we could to come in and apply for THA. And so we are really at a point right now where numbers are very low of those that have been being sheltered under Code Blue. And currently, the state has relaxed some regulations for some people. We have seen a relax of many of the work requirements that come with THA and TA typically, and with many of the requirements for currently applying clients for things like substance abuse treatment when that's required. It is still in force for clients that have already been on THA or TA. The substance abuse part is the work requirement is staying in force. It depends on whether or not people can actually work, because like the rest of us, unless they're essential workers, they're not required to go to work either. So we're seeing kind of a relax there, and we're trying as much as we can to really support people and err on the side of making sure that people stay sheltered. We are going to see that small group of people that are not willing to come in and apply for THA. And we're trying as much as we can, we're trying to kind of find out, it's not always possible, but we're trying to find out in those situations, where is that person going to seek shelter, try to make sure that they're not going to be seeking shelter, say on an elderly person's, somebody's grandma's couch, that kind of stuff, and potentially putting them at risk. So we're doing everything that we can to try to support people around this. So that's kind of the general update on Code Blue. Is there anything else you would want to know, Shauna, that I've left out?
I think that's good. I just want to see if there are any questions. Let's see here. Sorry, I'm just trying to make sure I see everyone's hand on the Zoom here. Okay, it does not appear that there are any questions. Thank you, Kit, for that report. That was great. I appreciate it. Okay, the next line of business we have, I just need to announce the appointments. And Kathy, do those need to be voted on?
Yes, they do.
Okay.
For the PERS and Rec Partnership.
Okay.
The voting ones, right?
Correct.
Yeah. Let me just make sure I have that. Sorry. Okay, so if I could have, what's on the table right now is the legislator voting seats for the PERS, the Personal Emergency Response Service Advisory Board. We are appointing Dan Klein, and he is currently in that role, and he will be serving again. And then the second role is for the Recreation Partnership, and Henry Granison would like to renew his role as well. If I could have a mover. Moved by Amanda, seconded by Glenn Morey. And is there any discussion on that? Martha? I can't hear you.
Sorry. At the Human Services Coalition Council, Human Service Coalition Board, they usually have me vote. So I don't know if that's, what their bylaws, like liaisons can vote, or I don't know, but.
We had already voted for other assignments in our last meeting. So you were the last meeting.
Right, I understand. My point was that I think HSC is on the list of non-voting, but I've always voted when I've been on there, and I'm on there now. I don't, doesn't matter. I mean, it's not
Huh.
big.
That is interesting. Yeah, Kathy, can you confirm? Because we do have HSC as a non-voting.
Yes, I'll look into that. Maybe they changed their bylaws and
Okay.
I don't know.
Or maybe I'm voting by mistake. Okay. Thank you.
Okay. Any other questions? Okay, I see none. We're going to do a roll call. Deborah Dawson,
Yes.
Amanda Champion,
Yes.
Glenn Maury,
Yes.
and myself is a yes. Okay, and at this point, we have minutes approval for March 16th, 2020. If I can have a moved by Amanda, seconded by Deborah Dawson. And are there any comments or questions? I see none. Let's do a roll call. Glenn Maury,
Yes.
Amanda Champion,
Yes.
Deborah Dawson,
Yes.
and myself is a yes. Thank you all. And right now we are at this segment of comments from committee members or liaison assignment reports. Is there anyone that would like to report or has comment? I see none. Okay. Well, it was a good run. We had an hour and 47 minutes of meeting today. Thank you all for attending and stay safe. Thank you very much.
Thank you,
Thank you.
Shauna. Thank you, Kathy.
Thank you.
Thank you, Jason.
Bye, everybody.
Thank you all.
Goodbye.